Hi everyone, this is Dr. Stefan. Welcome to Interstitial Lung Disease Info. In this video, I'd like to discuss about treatment for fibrotic NSIP. Well, let's talk a little bit about fibrotic NSIP. So NSIP stands for non-specific interstitial pneumonia. Now, all these acronyms, I understand. If you are struggling with interstitial lung diseases, you go see a doctor, you get a letter back with all these acronyms. It's, game over, let's just say. So it's very, very confusing, not only for you as a patient or a carer, but also for other healthcare providers, because all these classifications, to be honest, they change. Every 10 years or so, we've got a new classification for interstitial lung diseases, pulmonary fibrosis, and we all put them in these boxes with all these acronyms. So non-specific interstitial pneumonia. Now this, when we talk about non-specific interstitial pneumonia, we are talking about either a radiological pattern, so something that we're looking at on the lungs on a CT scan, or something that's on a biopsy sample from the lung. So something that the pathologist will look at in the lab and call it NSIP. Now, when we have NSIP, this is sometimes in the context of another condition, or it may also not have a known cause. So this is where things get a little bit tricky. So I'm getting to the treatment, but I want you to understand the context of what we're dealing with here. So NSIP then could be in the context, it's a pattern that could be in the context of another condition. Most commonly in the situation when we've got a connective tissue disease. And when we call connective tissue disease associated ILD, when we say that, sometimes that can be linked to an NSIP pattern on the chest CT scan. So when we talk about things like rheumatoid arthritis associated ILD, so someone who's got rheumatoid arthritis, someone who's got another mixed connective tissue disease, something else, and we've got a non-specific interstitial pneumonia pattern on the chest CT scan, this is where we're aiming for. So we're kind of trying to put all these patterns, all these descriptions of the condition together in something that makes sense. So I know this is confusing, but basically what you need to remember is that NSIP is a pattern on the chest CT scan or on a pathology report, and it can occur in the context of a connective tissue disease, for example. So sometimes people may have a condition that affects other systems of the body, something like rheumatoid arthritis, something autoimmune, something mixed connective tissue disease, and it can lead to these patterns. Or sometimes they can just appear on their own, and we call that idiopathic NSIP. So NSIP pattern of an unknown cause, idiopathic NSIP, that can occur in the absence of a non-connective tissue disease, or the connective tissue disease may appear later on. It could be the first sign that something's going on. So I hope this clarifies things a little bit. Please go back and listen to this again, because I think it's really important to just understand these concepts about interstitial lung disease, because then everything else is a little bit clearer. Now, the question that I got on the channel was about, can we start immunosuppressant therapy, antifibrotic therapy, and corticosteroids, 3 of them together, to treat NSIP, fibrotic NSIP? This was one of the questions that I got on the channel. And I think it just kind of triggered me because I need to explain things a little bit. So when we have NSIP, then generally we have some kind of inflammation going on in the lungs that may be leading to scarring. Now that can be due to some connective tissue disease that we can identify and maybe treat, or sometimes we don't have a known cause. But in general, we do have inflammation that's excessive on the lungs. So when that's the situation, we may want to reduce that inflammation, the body's own reaction to whatever's going on, whatever's triggering it, this dysregulated immune response. We want to dampen it down a little bit so that we don't get the scarring, or we stabilize the scarring so it doesn't get worse. And I think this is really tricky, because some of the medications that we have to reduce the immune response, you can imagine, it may make you more prone to infection. It can give you some other side effects. If we're talking about corticosteroids, these can have some known side effects, such as increasing blood pressure, diabetes, things like that. So we need to always balance all these things against the benefits that we obtain. But sometimes the risks of the medication actually are not as strong as getting really, really bad fibrosis on the lungs. So if the fibrosis is really significant on the lungs, it's getting much worse, you're hardly able to breathe, it may be a situation when we need to introduce some treatment, even though there may be some side effects in other organs. We're just trying to make the best of a bad situation, if that makes sense. But when we talk about treatment for NSIP, so again, we're trying to reduce the inflammation in the first instance to try to see if that stabilizes the inflammation, because that's what we assume is triggering the scarring. The first line of treatment usually is corticosteroid treatment. So this could be something like prednisolone. And this is usually a treatment that we commit to for a fairly long period of time, so at least months or maybe a year or more, just because we want to see what's going on over time. Are we stabilizing the inflammation? Are we stabilizing the fibrosis by reducing the inflammation in the lungs? And this is what we're aiming for, lung function to sort of stabilize over time. If that's not happening, again, we need to think about increasing the treatment. So for example, we may add on an immunosuppressant. So this could be something like mycophenolate. This is a very common drug that we use in interstitial lung disease, which we add on top of the steroids to again reduce the immune response a little bit further to try to stabilize the condition. Or in some situations, we might not use immunosuppressants necessarily to sort of increase the treatment, increase the immune suppression. We are using that as a steroid-sparing drug. So we're basically adding things like mycophenolate, for example, on top of the steroids, but the aim is to reduce the steroids. So we are sort of on the steroid treatment, if this makes sense. It's stable, but the condition is not, it's relatively well controlled. So let's say the condition is controlled on this dose of steroids, it's fairly high. We're trying to reduce the dose. So we introduce the immunosuppressant, and then we reduce the steroids, and you're left on the immunosuppressant, if that makes sense with my gestures. But basically, this is what we're trying to do. We're trying to sort of increase one, get the other one down. So this is a steroid-sparing strategy when we introduce immunosuppressants on top of the steroids with the goal of reducing the steroid treatment. Now, on top of this, we can sometimes use antifibrotic medication. So antifibrotic medication, or nintedanib in the case of NSIP, really, we don't really have a lot of other options approved at this point, and when I'm making this video in early 2024. So antifibrotic medication, or nintedanib in this case, is there to reduce the rate of scarring, so reduce the rate of lung function decline over time. Now, when we have pulmonary fibrosis that's progressive, despite being on a stable first-line treatment, we are thinking that maybe there is some kind of a process that's in the body that's driving the fibrosis that's not linked only to the inflammation. So that's why we've tried to treat the inflammation, but the scarring is still getting worse. And we can see that on chest CT scans, the lung function is getting worse, the symptoms are getting worse. If we're in that situation, we want to maybe slow down the scarring process. And we have antifibrotic or anti-scarring medications such as nintedanib at this stage. Maybe we'll have others in the future as well that are able to maybe reduce that process. So the lung function trend, if it's going down like this, maybe we'll try to stabilize it a little bit over time. So it reduces the rate of decline, buys us time basically. And we can add the antifibrotic or anti-scarring medication on top of the other first-line therapies that the person may be on already. So if you're treating NSIP with immunosuppressants or maybe with corticosteroids, we can sometimes add the antifibrotic as well, and it becomes a big cocktail of medication, and I appreciate that, and we need to be mindful of side effects and monitor things carefully, do routine blood tests, etc. But we are trying to maximize the treatment that we are offering to try to stabilize that scarring condition of the lung, because the problem is with scarring at this point, we don't have treatments that reverse it. So we're trying to intervene as early as we can to try to stabilize things in the long run. So I hope this makes a little bit of sense to try to understand how these therapies are being implemented. But it's really, really important to have appropriate follow-up for your interstitial lung disease. So if you're suffering with fibrotic NSIP or another form of interstitial lung disease, it's really important to have regular follow-up with your doctors, with your medical team. First, because you may be on a lot of medication, so you may need regular blood monitoring, and we generally aim to do that at least every 3 months. And then we might also need to monitor you for side effects, to monitor what your lung function is doing, what your scans are doing over time. We don't tend to repeat the CT scans very, very often, so because we don't expect that it will change our management and you're just getting radiation. But if there is an indication that the lung function is going down, there's no explanation for it, we think that the condition may be getting worse, your doctor may recommend doing another scan to check. So hopefully this clarifies things a little bit regarding fibrotic non-specific interstitial pneumonia or fibrotic NSIP. If you have further questions, leave them in the comment section below. I'm always trying to be on the lookout for questions that I can answer that clarify things that I see actually in the day-to-day practice. Thank you very much. All the best. Good health.